Welcome to the deep dive. Today we're diving into a bunch of sources. You send us articles, clinical guides, research papers, all looking at this condition in cats that, honestly, when you first see it, must look absolutely terrifying.
Oh, it really is. For an owner, seeing your cat suddenly just lose all balance, head cranked over, eyes darting,
Yeah,
it's incredibly alarming. You'd think it's, something catastrophic happening in the brain.
exactly. And that condition, the focus for this deep dive based on your material, is Feline Idiopathic Vestibular Disease, or FIVD for short. Our mission really is to unpack these sources, get a handle on what's actually going on, and maybe most importantly, explore why something that looks so incredibly scary, well, why it usually turns out okay, surprisingly okay.
Yeah, we'll kind of peel back the layers, look at the underlying system, what those dramatic signs really mean, how vets figure it out, the whole diagnostic path, and then how it's managed and what recovery looks like. It's a real journey from like sheer panic to relief, hopefully guided by what's in these sources.
Okay, let's get into it then. Feline Idiopathic Vestibular Disease. Big name. What are the sources actually telling us it is?
Well, the basic definition, pulling from these papers, is it's an acute onset, meaning sudden, non-progressive disturbance. And it affects the peripheral vestibular system in cats.
Okay, peripheral vestibular system. That sounds technical, but it's essentially the balance center, right? Like in the ear.
Yeah, think of it as the cat's internal gyroscope in GPS. It's absolutely vital for balance, for knowing which way is up spatial orientation, and for coordinating eye and head movements. Keeps them steady.
And the sources break it down into two parts.
That's right. You've got the peripheral part that's out in the inner ear structures and the nerve, the eighth cranial nerve, that connects the ear to the brain. And then there's the central part, which is actually inside the brainstem and the cerebellum.
And the crucial point here, from what I'm reading in these sources, is that FIVD is a peripheral issue. It's out in the ear or that nerve, not the brain itself.
Absolutely. That's the key distinction. It helps differentiate it from, more serious brain problems.
Okay, so we've got feline cats, vestibular disease, balance system problem. What about the idiopathic part? That usually means we don't really know, right?
Exactly. Idiopathic basically means the specific cause hasn't been pinned down. It's one of the frustrating parts of FIVD.
Mm-hmm.
But the sources do talk about some theories.
Theories, like
Yeah.
what might be triggering it?
Well, one idea involves maybe abnormal fluid flow, endolymphatic fluid, within those tiny canals in the inner ear.
Mm.
Another possibility is some kind of maybe intoxication affecting the balance receptors there, or even inflammation of the vestibular nerve itself. One source mentioned it might be similar to something called vestibular neuritis in humans.
Interesting comparison. So a bit of a mystery on the exact trigger, but we know it's a glitch in the nervous system's balance control, specifically out near the ear. Does this happen a lot in cats?
It's described as sporadic, acquired, meaning they aren't born with it usually. It's apparently rare in really young cats, under a year.
Yeah.
But unlike the dog version, which often hits older dogs, FIVD can affect cats of pretty much any age. Though, yeah, you do see it quite a bit in older cats, too.
Do the sources mention any kind of pattern, like time of year or maybe linked to other illnesses?
There are some mentions, yeah. Possibly a slight increase in cases in summer or early fall. Maybe sometimes after upper respiratory infections, though it definitely pops up all year round. And interestingly, there's a note about potential inherited forms in breeds like Siamese and Burmese.
Right. Okay, let's get to the part that would send any owner into a panic. What does this actually look like? The signs described in these sources sound intense.
Intense is a good word. Yeah, the onset is typically really sudden, acute, dramatic. Owners often say it happened in minutes or maybe over a few hours. And the descriptions are things like, my cat looks drunk, or even, I think my cat's having a stroke, which is terrifying.
So what are the specific things someone might see, according to these sources?
Okay, let's list them out. First, usually the most obvious, is a really noticeable head tilt. And it's almost always tilted towards the side that's affected. If rarely both sides are involved, the head might kind of wobble or just have a milder tilt to the worst side.
And balance is obviously shot.
Oh, completely. That's the ataxia. Severe incoordination. You see staggering, stumbling, leaning over, falling, sometimes even rolling, often towards the same side as the head tilt. They might crouch low, try a wide stance, or just refuse to move because they're so unstable.
Circling, too, I imagine.
Yep, often tight circles, and again, usually towards the direction of the head tilt.
You mentioned the vestibular system coordinating eye movements. What happens to the eyes?
Ah, yes. This is a really key sign called nystagmus. It's this rapid, involuntary, kind of jerky eye movement. With peripheral disease like FIVD, it's usually horizontal, side to side, or maybe rotary, sort of circular.
There's something really specific about the direction of that movement, isn't there? The sources really highlighted this.
Yes. This is super important for diagnosis. The nystagmus has a fast flicking part and a slow drifting part. The fast part is always directed away from the side with the head tilt, away from the affected ear.
Away from the bad side. That seems weird.
It does seem counterintuitive, right?
Yeah.
But it's like the healthy side is overdriving things, pulling the eyes back quickly. So fast phase away from the lesion, we say. If both sides are affected, you might not see much nystagmus, or normal eye movements might just be reduced.
Okay, so head tilt, falling over, eyes jerking. I'm guessing they feel pretty sick.
Oh, definitely. Nausea and vomiting are really common. That intense spinning sensation is like the worst motion sickness imaginable, which understandably often makes them not want to eat.
And they must just seem lost and confused.
Totally. Disorientation is a big factor. They often look bewildered, maybe restless, sometimes they'll cry out. They're distressed by what's happening to them.
And there was one other eye thing mentioned, positional strabismus.
Right, that's where the eye position might look abnormal, like one eye drifts down, but only when the head is held in a certain way. Another subtle clue related to that vestibular eye connection.
Wow. Okay, those signs are, yeah, incredibly alarming. But the sources make a really important point about what isn't usually happening, right?
Yeah.
To differentiate it.
Yes, this is maybe the most critical piece for the vet during the exam. In FIDD, even though their balance is totally gone, their actual strength and proprioception, that sense of where their limbs are, should be normal. They might not want to walk because they're dizzy, but it's not because they're weak or can't feel their feet properly.
Ah, I see.
That's a major difference from central vestibular disease, a brain problem, where you would often see weakness maybe knuckling over on their paws, especially on the same side as the tilt.
Okay, so if you see these signs, how does a vet figure out if it's this specific idiopathic thing, FIVD, versus something else, maybe more serious?
Right, so this is where the idea of a diagnosis exclusion comes in. There isn't one single test that screams FIVD. It's more about systematically ruling out everything else that could cause those signs.
Okay, walk us through that process. What do the sources say the steps are? How does that detective work start?
It always starts with a really thorough history from the owner. The vet needs all the details. When did it start? How fast did it come on? Has it changed? Any history of ear infections? Any recent head trauma? What medications is the cat on? The sources specifically flag certain drugs that can be ototoxic, toxic to the ear, like some antibiotics, aminoglycosides, even metronidazole sometimes.
Okay.
Plus about toxin exposure, too, like that weird one mentioned blue-tailed lizard ingestion down in the southeast U.S., causing similar signs. And travel history, general health, all of it.
Then the physical exam, focusing on the ears and nerves.
Exactly. A full general physical, of course. But then a really close look at the head and nervous system. The otoscopic exam is key, looking down the ear canals with a scope, checking for infection, inflammation, polyps, foreign objects, anything obvious affecting the eardrum or canal that could impact the middle or inner ear.
And the neuro exam is where the real differentiation happens, peripheral versus central.
Precisely. That's the main event, diagnostically speaking. The vet is looking for that classic cluster of peripheral signs. The head tilt, the specific type of nystagmus, horizontal rotary, fast phase away, the severe ataxia, the nausea, and crucially, they're looking for the absence of those central signs.
Remind us what those red flags for central brain-related issues were.
Things like changes in the cat's mental state. Are they depressed, stuporous, acting really out of it? Is the nystagmus vertical, up and down? Is there actual weakness or knuckling, especially on the same side as the tilt? Or deficits in other cranial nerves, like trouble swallowing or reduced feeling in the face? Finding those points towards the brain. The only caveat mentioned is sometimes you can see concurrent facial nerve paralysis or Horner syndrome with the eyelid and pupil, even with peripheral disease, just because those nerves run so close by the ear structures.
What about blood work? Does that help pinpoint FIVD?
Usually not directly. Standard blood tests, CBC, chemistry panel, urinalysis are typically normal and straightforward FIV cases. They're done more to check overall health, rule out other systemic problems. If central disease is suspected or maybe a metabolic issue, then yeah, more specific tests might be run thyroid, infectious disease titers, maybe thiamine levels.
And imaging, X-rays, CT scans, MRIs, are those always needed?
No, the sources are pretty clear. For classic presentation of FIVD with no central signs, imaging usually isn't necessary for the diagnosis. It really comes into play if the neuro exam does suggest central involvement, or if the signs are weird like vertical nystagmus, or if they get worse instead of better, or just don't improve quickly like they should.
And if imaging is needed, what's the best approach?
CT or MRI are definitely the preferred tools then. They give incredibly detailed views of the brainstem, the cerebellum, and importantly, those bony structures around the middle and inner ear, the tympanic bullae. These scans can find things like tumors, inflammation, strokes, or deep ear infections or polyps inside the bullae that you just can't see with the otoscope. Skull x-rays can sometimes show changes in the bullae, but they're way less sensitive than CT or MRI. Normal x-rays don't rule out problems there.
Any other specialized tests mentioned?
Brainstem auditory evoked response, PAER testing comes up. It measures how nerve signals travel along the hearing pathway. It's not really about checking if they can hear. Hearing itself isn't typically affected in FIVD, but about pathway function. It can help rule out other things like chronic otitis or polyps affecting that nerve conduction. CSF analysis testing the spinal fluid might be considered if there's a strong suspicion of brain inflammation or cancer.
And if they were to look at tissue samples, is there a specific change they see with FIVD?
Nope. The sources say there are no specific pathological findings reported for FIVD itself, which kind of reinforces that idiopathic unknown cause aspect.
So the diagnosis is really like assembling clues. Get the story, do a careful exam looking for that specific pattern of peripheral signs, rule out the mimics with tests and imaging if things don't fit the classic picture.
That's exactly it. You're crossing off the list things like ear infections, otitis media interna, those nasopharyngeal polyps, the lizard thing, drug reactions. And a big clue often comes later, the fact that true FIVD usually gets better on its own relatively quickly, whereas those other things need specific treatments.
Okay, so once you've arrived at that diagnosis, feline idiopathic vestibular disease, what's the treatment?
Well, this is where the good news really starts, and it's consistent across the sources. There's no specific cure needed for FIVD itself, because by its nature, it's self-limiting. It resolves on its own.
Ah, okay. So treatment isn't about fixing the underlying unknown cause. It's about helping the cat through it.
Exactly. Treatment is all about supportive and symptomatic care. The goals are just keeping the cat comfortable, keeping them safe, and preventing any secondary problems while their body recovers.
Does the cat usually need to be hospitalized for this?
It depends on how severe the signs are. For milder cases, home care is often fine. But for cats that are really severely affected, like constantly rolling, extremely disoriented, or so nauseous and dizzy they can't eat or drink, hospitalization might be needed for more intensive support, especially things like intravenous fluids.
What kind of supportive care are we talking about, whether at home or in the clinic?
The main thing is creating a safe, confined space. A small room, a large carrier, something well padded so they can't fall and hurt themselves when they lose balance. Restricting activity is key initially. Then, hydration and nutrition. Offering really tempting, palatable food, maybe small meals often. Keeping the food, water, and litter box close by and low to the ground. If they really can't eat or drink, that's when fluids come in. Maybe subcutaneous fluids given under the skin at home or IV in the hospital. Plus basic nursing care, keeping them clean, providing soft bedding to prevent sores if they're lying down a lot, and keeping the environment calm and quiet to minimize stress.
Are there medications that can help with the symptoms, like the dizziness or the vomiting?
Yes, definitely. Medications are used to manage those symptoms and make the cat feel better. Antiemetics, anti-nausea drugs are really important. The sources mention meropenem specifically as being very effective for the vomiting and likely the nausea too. Some older drugs like meclizine are mentioned, but maybe less effective in cats. And for those really distressed, severely disoriented, or rolling cats, mild sedatives like diazepam or esomeprazole might be used short-term just to calm them down and reduce the risk of self-injury.
What about anti-inflammatories like steroids? Do those help speed things up?
That's a key point the sources make. Glucocorticoids or steroids are generally not recommended for routine FIVD cases. They haven't been shown to change the course of the disease itself, and using them could potentially mask or worsen an underlying infection if one couldn't be completely ruled out.
So probably no steroids for the idiopathic cases.
That seems to be the consensus in these materials. However, antibiotics might be used if the vet has a reasonable suspicion that an underlying middle or inner ear infection, otitis media interna, could still be present and wasn't definitively ruled out. They mention examples like trimethoprim sulfa, cephalexin, amoxicillin clavulinate drugs that can get into that area.
And obviously, if the diagnostic workup did find a specific cause, like an infection or a polyp,
Then absolutely, the treatment would target that specific issue, the right antibiotics or infection, maybe surgery for a polyp, or whatever is appropriate for the actual diagnosis.
it sounds like communication with the owner is just huge here, explaining what's going on.
Oh, completely vital. Being able to reassure the owner that, yes, this looks absolutely horrific right now, but the prognosis for this specific condition, FIVD, is actually excellent for recovery. That's a massive part of managing the situation. It helps alleviate so much stress.
Okay, let's dive into that prognosis then. After seeing their cat go through something so dramatic, what can an owner really expect recovery to look like?
The prognosis for true feline idiopathic vestibular disease is generally described as excellent. That's a really positive takeaway.
Excellent.
Right.
Really, even after all that falling and head tilting?
Yes. The sources consistently state that you usually see significant improvement, especially in the nystagmus, the eye movements, within a remarkably short period, often within 72 hours. That rapid initial improvement is quite characteristic.
And the balance and head tilt follow after that.
They do. Progressive improvement in their gait, their coordination, and the head tilt continues over the following days and weeks. Most cats are pretty much back to normal, or very close to it, within about 2 to 3 weeks.
Does the head tilt always completely vanish?
It's often the very last sign to resolve. And in some cats, a slight mild residual head tilt might persist long-term, maybe even for life. But, importantly, the sources emphasize this usually doesn't bother the cat or affect their quality of life at all. They adapt perfectly well.
What if things don't get better quickly? What if after a few days the cat isn't showing that marked improvement?
That's a major red flag. If the signs aren't improving rapidly, especially within those first few days to a week, it strongly suggests that it isn't just straightforward FIVD. That's when the vet absolutely needs to dig deeper, pursue those other potential causes more aggressively, likely involving that advanced imaging like CT or MRI if it wasn't done initially. That quick recovery is really a hallmark.
Can it happen again? Can a cat get FIVD more than once?
It's considered rare, but yes, the sources do note that recurrence can happen. Sometimes it might affect the same side again, or sometimes the opposite side.
And just to be clear, the condition itself, the underlying FIVD process, isn't painful or dangerous.
Correct. The condition itself isn't considered painful and it's not life-threatening directly. The real risks come from those secondary problems, injuries from falling, or complications like dehydration or malnutrition if they're too nauseous or unstable to eat and drink properly. That's why that supportive care is so critical.
So pulling it all together, what's the bottom line for someone whose cat suddenly develops these signs?
The bottom line is, while seeing feline idiopathic vestibular disease start is incredibly frightening and looks like a disaster, once a vet has done the work to rule out other, more serious causes, and with good supportive care to keep the cat safe and comfortable. The vast majority of these cats will recover remarkably well, usually quite quickly, and get back to their normal, happy lives. It's one of those conditions where the initial scare factor is way, way higher than the actual long-term danger.
Wow. So we've really unpacked feline idiopathic vestibular disease today using the materials you shared. We've gone from understanding its somewhat mysterious nature and those really dramatic signs, through the diagnostic puzzle, the importance of just supporting the cat through it, and landing on this surprisingly hopeful prognosis.
Yeah, it really shows how digging into the details, looking at the clinical information, can take something that seems completely overwhelming at first glance and make it understandable, manageable, and in this particular case, thankfully, usually something with a very positive outcome.
It absolutely does. And it kind of leaves you thinking, doesn't it, about this incredibly intricate system, the vestibular system that just keeps us and our pets balanced and oriented without us even noticing most of the time. How can something so fundamental, working away silently second by second, cause such utter chaos and disorientation when it gets temporarily knocked offline? It really makes you wonder, how often do we stop to appreciate these complex, usually invisible systems running perfectly in our own bodies and in our animals until something goes sideways and forces us to see just how amazing and sometimes fragile they really are?